And welcome back to the show. June is National Migraine and Headache Awareness Month, and the month actually recognizes and honors the headache and migraine communities who are working together for disorders to be recognized as legitimate neurobiological diseases. Now, migraines is one of the world's most common health conditions and its most common neurological disease. Nearly 35 million people in the United States and 1 billion people worldwide have migraines. Join me now to tell us more details. We got neurologist, epidemiologist, and headache and facial pain specialist at the Nuvance Health Neuroscience Institute in Kingston, New York, and also assistant professor of neurology at Albert Einstein College of Medicine, Dr. Julio R. Vieira, I should say. And Dr. Vieira, thank you so much for being with us.
Thank you, Daren. Appreciate you having me here.
So, I mean, on a common sense, I want to say that a lot of people say, I've got a migraine, and then they'll say, I've got a headache. And there is a difference between a migraine and a headache. So I want to open up, first of all, but you just given us a little bit of the information as to the difference between just that.
Definitely, Darren. That's a great question. Unfortunately, a migraine is not just a headache like a lot of people think. And headache, even though it's debilitating, migraine comes with many other features. It puts you down. Sometimes you cannot do anything. You need to hide from everybody. People have light sensitivity, sound sensitivity, difficulty to concentrate and to relate to people. It really puts them down. So it's not just a headache. And also it gives them nausea. Some people have vomiting. It's worse when they move around. And it's really debilitating. According to the World Health Organization, it's considered to be the #2 debilitating condition in the entire world, only after back pain.
And when we talk about the differences between the two, you clearly outlined it, but talk to us a little bit about the signs and the symptoms when a person knows that they're actually having a migraine as opposed to a headache.
Sure, a migraine is associated with multiple other features, including sound sensitivity, light sensitivity. Some people have smell sensitivity as well. They also have nausea. Some folks have vomiting. And those are the main features that accompany the migraine.
Mm-hmm. We hear the word chronic migraines too as well. And so what would qualify a person to say, I have chronic migraines?
So chronic migraine, the definition of chronic migraine is a person that has more than 15 headaches a month, or actually 15 headache days a month, and more than 8 migraines a month. Even though there's a lot of folks that have migraines here and there, and they've been having for years and years and years, unfortunately, those are not considered to be chronic migraine. So the definition of chronic migraine are those who are having more than 15 headaches a month and more than 8 migraines a month for more than 3 months.
Dr. Vieira, if somebody's watching right now and says, listen, you know what, I do suffer from migraines, but you just told me about chronic migraines, I'm worried about progression. And what that simply means is there a way that because I do have migraines that I could probably be upgraded into that chronic migraine stage by the fact that I do have migraines?
Definitely. So given that chronic migraine is mainly based on the frequency of the number of attacks that you have, the goal is for us to keep the attacks at bay and minimize the number of attacks that you have. Because even though the classification changes when you get between 14 and 15 days, those are only ways that we found in terms of research, folks, so we can talk the same language. But if you have 14 headaches in a month and somebody has 15 headaches in a month, even though you wouldn't be qualified as a chronic migraine, you were pretty much there, and it's very debilitating as well.
Yeah. Let's talk demographics for a minute. Is there any particular demographic that is at risk for this, for migraines?
Yes, Darren. So the prototype of migraine, the main people featured in migraine are, it can happen with everybody, men and women, it doesn't really matter, but it's usually more common in women during their reproductive age. So when the women started having their periods, and when they stop having their periods, that's the peak of their migraine. So approximately On average, 12% of the population have migraine. And comparing men and women, it's about 6% in men and 18% in women. So 3-to-1. That's a big difference.
Yeah. And for me, I really wonder, because when we hear people go through the situation of migraines and, they come and you hear, I've got friends who've had them. I often wonder, how often will they be affected by it? Is it something that will go away over time, or are people more prone that once they have a migraine to see migraines reoccur?
So unfortunately, there's no cure for migraine, but there's a way for us to keep it at bay and control it really well. There are folks, as they get older, sometimes they get lucky and they have much less attacks, but there are others that continue to have several attacks and continue to be very debilitating even when they're older. For the most part, it affects a lot of people when they're younger, but it doesn't discriminate. It affects everybody. You can get, doesn't matter if you're young, if you're old, everybody's at risk for having a migraine, unfortunately.
Yeah. Well, I want to talk about how we can medicate this now, because when somebody has a migraine, aspirin is always talked about, but we know that sometimes aspirin just isn't the answer. What are the ways that a person can actually take medication to be able to assist with migraines? Or if you want to share, what are the various types of medication that you actually use when it comes to really treating someone with migraines?
Definitely. So the way we treat migraine, usually we would have an approach that encounters with 3 different things. We need sometimes it depends on the number of headaches that you're having. You would require a prevention medication, especially for folks that have more than 2 debilitating attacks in a month or more than 4 regular headaches in a month. And that varies from multiple different classes of medication. Usually we borrow medications to treat other conditions, main conditions being blood pressure medication, anti-seizure medication, and antidepressants. That has been traditionally what we've been doing. Sometimes we use natural products as well, including magnesium or riboflavin, which is vitamin B2. Sometimes we use feverfew or coenzyme Q10, things like that. But thankfully, since 2018, we now have a different class of medications, which are based on something called CGRP, which is an abbreviation for calcitonin gene-related peptide. And those medications are migraine specific. So it took a long time, but finally, since 2018, now we have multiple different medications that are based on CGRP, which appears to be the main avenue that migraine works in our body. Whenever we're having a migraine attack, CGRP goes up, and those medications, they either block the receptor of CGRP or they change the way CGRP works on the receptor, and then you start having less attacks of headaches. The other feature that we use is the abortive medication, which is a medication that you would take whenever you have a migraine attack. And that also varies between multiple different options, including over-the-counter like ibuprofen, or some people try Tylenol, but then we have the migraine-specific medications traditionally from previous generations called triptans, which there are a variety of them. Others are called DHE or dihydroergotamine. Those are migraine-specific medication. And thankfully, not too long ago, now we have the other class of medication, which are CGRP blockers. They're also used for that. And other newer medications are coming out as well.
Dr. Vieira,
and then we also have devices that you can use. We have stimulators, we have vagal nerve stimulator, we have a neuromodulation as well. We have a patch that you can put on the arm. We have magnetic stimulation that you can put on your head. We have a stimulator that you put on your forehead as well. There are different gadgets as well that folks that have migraine can have access to nowadays.
A lot of new information. I mean, I know typically we talk about aspirin to hear things that I've heard people talk about, but you've definitely put a new spin on letting people know what's actually out there and available. Dr. Vieira, thank you so much for sharing with us a little bit as we talk about National Migraine and Headache month, and we want to thank you for the information that you provided. Hopefully somebody will take advantage of it. Thanks much.
Thank you, Daren. Appreciate it.
All righty. Dr. Julio R. Vieira, our guest here. I want to let you know that if you want more information, don't hesitate to visit their website at einsteinmed.edu and then also nuvancehealth.org. We have more show coming up. Don't go anywhere. Open continues coming up in a few.